According to statistics, over 70,000 persons die of cancer-related disease annually in Nigeria. Further analysis indicates that 24,414 men die of the disease, while over 41,000 others are female. Worried by this trend and in effort to change the narrative, a non-governmental organization, Project PINKBLUE, in collaboration with oncology specialists from the United States of America, organized training on treatment of cancer for 34 pharmacists across different states in Nigeria. At the Trauma Center, National Hospital Abuja, the venue of the training, the Executive Director, Project PINKBLUE, Runcie Chidebe, explained that pharmacists were zeroed into the training due to their drug-related role in managing the disease. Represented by the Program Manager, PINKBLUE, the Executive Director advocated need why the federal government must invest more resources in procurement of cancer detection and treatment equipment.
Our infrastructure is not doing well. We all know that our health infrastructure is not doing well, and it's really impacting the patients negatively. So we just hope that the government will do more than it is doing currently. But having said that, we also want to commend the government for there's this cancer health fund which the government is trying to do, and even though they've disbursed funds for last year and this year, and no cancer patient has gotten the money, but it's a step in the right direction, and we want to really appreciate that effort. And in fact, so far now, people have been asked to go to the health centers to go and start the process so that they can be treated from that fund.
Cancer is not just one disease. It affects every part of the body. So because of that, one have to prevent three factors or measures in order to curtail the menace of cancer in this country.
Meanwhile, speaking to journalists on the sideline of the training, the two US-based, board-certified Fulbright oncology specialists expressed the view that Nigerian government needs to invest adequate resources in facilities, training and retraining of oncology professionals.
I believe that same inspiration and desire here in Nigeria is present. Having those resources for equipment and safe delivery of therapies, specifically within my space, cytotoxic chemotherapy, and the ability to make that therapy in a controlled biological safety cabinet where those who are making that chemotherapy are not exposed to the drugs, and that nurses and patients and everyone else who might see those drugs afterwards are also fully protected from what side effects might happen from exposure to them.
There are definitely some resources that are missing or needed here in Nigeria to appropriately be able to make these chemotherapy agents for our patients. So I think it's really important that pharmacists learn what is needed to be able to safely handle and safely deliver those medications, and that we find advocacy ways to make sure that we're able to access those resources and bring them here to Nigeria.
The oncology specialists are also of the view that early detection and treatment of cancer remains the surest way to defeat the pandemic. CNN News.